Preventable diseases kill 41 million people each year, equivalent to 74% of all deaths globally. Now, when me and my friends found out this information, we were quite shocked. Now, thankfully, one of the United Nations goals is to ensure healthy lives for all ages. Now, there's unhealthy people all around the world, but let's talk about just right here in the US for a second. Analysts showed that in 2010, nearly half of all deaths, 48%, were linked to behavioral and other preventable causes. Now, to help us solve this problem, we went and interviewed an up-and-coming healthcare student to see how we can stay healthy right here in the United States. What is your name and your occupation?
My name is Candace Coleman. I have no occupation.
What are some solutions we need to take as society in order to ensure healthy lives?
We need to take into consideration our diet, our exercise, and our mental mindset.
Do you think that countries like the US and Great Britain need to team up to tackle the issue of ensuring healthy lives across the world?
Yes.
Now let's talk about that. Smoking is the leading cause of preventable death. Worldwide, tobacco use causes more than 7 million deaths per year. If the pattern of smoking all over the globe doesn't change, more than 8 million people a year will die from diseases related to tobacco use by 2030. Smoking increases the risk of early death from cancer, heart disease, stroke, lung diseases, diabetes, and chronic obstructive pulmonary disease. A recent report from the American Heart Association has drawn attention to the health risks of e-cigarette use. It raises concerns about potential heart and lung issues. Teenagers between 15 and 17 years of age have a 16 times greater chance of vaping than adults between the ages 25 and 34. Fortunately, a study released today from the U.S. Centers for Disease Control and Prevention and the U.S. Food and Drug Administration shows that among high school students, current use of any tobacco product declined during 2022 to 2023, 16.5% to 12.6%, primarily driven by a decline in e-cigarette use. It's plain and simple. If we can stop using e-cigarettes and tobacco, then the causes of preventable death will go down.
Now that's just the US, but let's talk about some different countries.
Go.
Every year, around 10 million people in poor countries die of illness that can be very cheaply prevented or managed, including malaria, HIV, and tuberculosis. Options for working on the problem include serving as a donor to affect projects, working as an economist in intergovernmental organizations such as the World Bank or World Health Organization, or starting or working in a nonprofit that scales up proven treatments.
Now, why are so many people dying in the first place? The study found that 38% of U.S. adults had skipped some form of health care, a test, treatment, or even a visit in the past year due to financial burden. We can fix this with telehealth. Telehealth provides remote access to physicians and other medical service providers to patients without a physical clinic in their area. Through video conferencing and cloud-based data, doctors can communicate across large geographic distances to better coordinate and care for patients. The reason why telehealth is so important is because in rural areas, you're not going to be able to just build medical centers left and right. That would cost a significant amount of time and money. Plus, we need to stop these preventable causes now before they keep on spreading. A great way is with telehealth. That way, if you don't have a medical facility near you, it can be brought to you. Now, this problem is bigger than every single one of us.
It's going to take all of us to tackle this problem.
The goal isn't to live forever, it's to create something that will.